This evening we'll be talking about health services in Manitoba. And I'll be giving you some information about what services are available, so you will know how to use those services. So to begin, as a patient here in Canada, you have many rights. So as a patient, you have a right to choose your own doctor. You have a right to ask questions. Any questions that you have about your body, your health, you can ask the doctor or nurse. And here, to see a doctor is always very busy and you don't have a lot of time. So it's always a good idea before you go for a doctor's appointment, and if you have any questions, write down all the questions on a piece of paper so you won't forget when you see the doctor. And you also have a right to receive information in a way that you can understand. Sometimes doctors they speak very fast, or sometimes they may use big medical words that are difficult to understand. And if you don't understand, you can let the doctor know, I don't understand. Can you speak slowly? Or you can tell the doctor, I don't understand what is the word meant. Can you explain in a simple way that I can understand? Or sometimes doctor talk to you about different organs in your body and different body parts, and you may have no idea which body parts the doctors are referring to. So you can let the doctor know, I don't know which body organs you are talking about. Can you show me a picture of a human body and show me and point to me which body organs you are talking about so I understand? So you need to remember the body belongs to you, so it's very important for you to understand what's happening with your body. There are more patients' rights. You have a right to receive information that help you to make decisions about your medical treatment. So I'll give you an example. For example, you go to see a doctor, you got some problem with your eyes, and you go to see a doctor, and the doctor say, oh, you need eye surgery. So before you make the decision, you need to ask the doctor, why do I need the surgery? What are the advantages and what are the disadvantages of the surgery? And you also need to know what are other options, what are other choices that I have if I don't have the surgery. So you need to understand all this information before you make a decision. And also, you have a right to get a second opinion. So for example, you go to see a doctor, and the doctor say, oh, you need an eye surgery. So if you're not sure whether this is the best things to do, in that case, you can go and find another doctor, a second doctor, and get the opinion of the second doctor. And all your medical information, all your personal information are to be remained in private. That means no one is allowed to share your personal information or medical information to anyone without asking your permission first. But there are some exceptions. For example, you go to see a family doctor and you got some problem with your eyes. So the doctor will refer you to see an eye specialist. In this case, the doctor will share your medical information to the eye specialist and it doesn't need your permission. And if you want to see your personal health information that is kept on record, you also have a right to ask for it. And also you have a right to know who looks after you, the name and the position of the person who looks after you. And in hospital and in clinics, usually there are many people around. They have doctors, student doctors, nurses, student nurses, and many other medical people. And they have a name tag with the name and the position. So it's always a good idea to look who they are, the name, and who they are in the hospital. And also, one point I would like to remind you is that never sign anything if you don't understand what you are signing. If in hospital, the doctor and nurse ask you to sign paper, do not sign unless you understand what you are signing. And also, you have a right to ask for an interpreter, that's someone that can speak your language. So is there anything that you don't understand and you need someone that speaks your language? You let them know, I don't understand, I need an interpreter. So they will try to arrange someone, an interpreter, a trained interpreter that can help you to talk to the doctor or nurse. And here we say that the body belongs to you, so you make decision about your body. So you have a right to receive treatment, medical treatment, and you don't need the permission of your husband or your wife. Of course, sometimes we may want to discuss, to talk with a husband or wife before you make a decision. But if there's a disagreement, for example, you want to go to surgery, but your husband doesn't want you, the final decision is with you, the one with the body, who make your decision about your body. And here in Canada, as a patient, everyone has a right to be treated with respect, to be treated equally. And no matter where you're coming from, your skin color, your religion, doesn't matter. Everyone's to be treated equally and fairly. Respect. Also, regardless about your sexual orientations, when we talk about sexual orientations, that means sometimes there are some people who are attracted to people of the same sex or people of the opposite sex. Doesn't matter. Doesn't matter about your sexual orientation. Everyone is to be treated equally. Okay, next part, I'm going to talk about what services are available here. So when you go to see a doctor, what you need is that you need your mental health card. For mental health, there are some services are free, but some services you have to pay. So the next picture are services that are free. So these services are paid by mental health, to see a doctor, to have a surgery in hospital. When a person stays in the hospital, and when the person is staying in hospital, during the stay, all the medicine, medical supplies, and food are covered by mental health. You don't need to pay. Also, another service is that when the doctor orders some blood tests or some special tests for you, you don't need to pay for those tests. So as you can see, these are all basic health services. And the basic health services, you don't need to pay. And the next picture, I'm going to show you services that you have to pay. Here, if you want to see a dentist, you need to pay. And seeing a dentist here is very expensive too. But there are some places, some community clinics that can offer some cheaper dental care services for you. And the next picture you can see is ambulance. Here, to use the ambulance, you also have to pay, and also it's very expensive. But on the other hand, if a person is in real emergency, for example, someone have a heart attack, this person needs to go to hospital right away. So call the ambulance, go to the hospital right away, and when the ambulance comes, they will take you to the hospital right away, and you don't need to pay $500 right at the spot. They will send a bill later. And sometimes we know that it's very expensive, $500, right? And if you have some difficulties to pay, you can make arrangement with them. You can pay monthly. The next picture is when you need eye examination and eyeglasses, you also need to pay. And for medicine, if you go to see a doctor and the doctor write the name of a paper, the name of the medicine of a paper, and ask you to go to the pharmacy to buy it, we call it those prescription medicine. So for prescription medicine, you have to pay. So the picture on the bottom, the person is doing exercise on her leg, right? So this person is seeing a physiotherapist. For physiotherapists, if you see in the hospital, you don't need to pay. But usually in hospital, there's a waiting period, waiting time. Sometimes maybe 2 weeks, 3 weeks, 6 weeks. In order a physiotherapist will see you. And if you say that, oh, it's too long, I don't want to wait, I want to see one soon. In that case, you can choose to see a physiotherapist in a private clinic. If you see a physiotherapist in a private clinic, you don't need to wait. The next day you have an appointment, but you have to pay. So the next picture, you can see this person have a sore back, sore muscle. And this person is seeing a massage therapist. So if you want to see a massage therapist, the mental health does not pay for you. You have to pay your own. And the next picture is about plastic surgeon, cosmetic surgery. For example, you don't like your nose. You want a different nose. So you go to see a plastic surgeon, and they can give you a new nose, but you have to pay your new nose. But if there's a car accident, because of the car accident, you broke your nose. In this case, the mental health will fix a new nose for you, and you don't need to pay because of medical reason, not because of beauty reason, because it's necessary, right? So these are services that you have to pay. So you can see here in Manitoba Health, the basic services are covered, but many other services that you have to pay. If you are under 19 years old and over 65 years old, you can have a free eye examination every 2 years. I think most of us in this classroom, we are over 19 and under 65, right? So we need to pay our eye examination. But if you have children under 19 years old, you can bring your children to see an optometrist to get an eye examination every 2 years. And if you have eye disease that need an eye specialist, in this case, the Manitoba Health is covered. You don't need to pay. Here we say that to see a dentist is very expensive, but there are places that you can go, some clinics that you can go for cheaper dental care services. And at the end of the class, your teacher will give you a handout, and we can go over some of the clinics at the end of the class. Pharma Care, we say that if you want to buy medicine, a prescription medicine, you have to pay your own medicine, and medicine can be very expensive here too. And if someone needs, because of a health problem that needs medicine, if the person takes many medicine, it can be very expensive. So there's a program that they can apply. It's called Pharma Care. So Pharma Care is a government drug benefit program that helps Manitoban to pay some of the costs of the medicine. And based on your income, you need to go to a pharmacy to get an application form and fill out the form. So based on your family income, they have a formula to calculate how much you need to pay for your deductible. So if you have a high income, you need to pay more for your deductible. If you have low income, you pay less. We know that for mental health, they only cover basic health services. Like when we talk about basic health services, is to see a doctor, surgery, to stay in hospital, and some blood tests and special tests ordered by the doctor, right? So if someone wants more health insurance, this person can consider to buy private health plans to cover other costs. So if you want to buy those private health plans, one thing that you need to pay attention is there are so many different kinds of health plans. And there are different types of health and dental plans. There's a cost, and they charge different rates. So you need to read carefully what they cover and how much they charge you. So the next part we'll be talking about where we can go if we are sick or if we want to see a doctor, where we can go. So one place we can go is called the family doctor. So family doctor look after the health of you and your family. And it keeps your medical record. It keeps your medical chart. That means the next time you go there, doctor doesn't know about your medical history and previous health problems. You can go to your family doctor for a checkup, physical examination, medical checkups. And if you have young children, you can bring your children to go to a family doctor for regular immunization, vaccination. And also, if you need to see a specialist, for example, you have some problem with eye, you want to see an eye specialist, or you have some problem with your heart, you want to see a heart specialist, you need to see a family doctor, and the doctor will refer you to see a specialist. And to see a family doctor, usually you need to call first and make an appointment. We know that sometimes it may be a challenge to find a doctor, a family doctor, because there's a shortage here. So it's good to look for a family doctor now. Don't wait until you are sick, because it may take you several months to find a family doctor that takes new patients. So if you are sick and if you don't have a family doctor, so another place that you can go is to see a doctor in a walk-in clinic. You don't need to make an appointment. You just walk in and ask to see a doctor. But one thing about walk-in clinic is that they don't keep your medical record. That means the next time you go there, they don't know about your medical history or your previous health problems. So to see a doctor in a walk-in clinic is good for health conditions that you don't need continuous care. It's good for like one-time thing, but if you need continuous care, if someone with a heart disease that needs continuous care, it's very important to find a family doctor. There's another service you can use. It's called Quick Care Clinic. So in the Quick Care Clinic, they treat minor illnesses or minor health problems. And you'll be seen by a special nurse, a specially trained nurse. We call this nurse practitioner. You can just walk in, or you can make an appointment first. They open evenings as well as on weekends. And there are 2 quick care clinics in Winnipeg right now. And at the end of the class, when we have time, we can look through the handouts. So what do you see in this picture? Broken arms, right? Yeah, some problem with the arms. Yeah. So if someone like this woman have a broken arm, or if someone maybe slip, because now the road is very slippery, right? Sometimes when we walk, it's very easy to fall. If you twist your ankle and you need to see a doctor, in that case, you can go to this special clinic, PAMN clinic. So for this PAMN clinic, they have special doctor for minor injuries, for bones, for joints, and for muscles. And another service you can use is called Urgent Care Center. For example, at midnight, you are not feeling well and you want to see a doctor. In this case, you can go to the Urgent Care Center because it's open 24 hours, 7 days a week. You don't need to make an appointment. You just go there and ask to see a doctor. But it's for health condition that is not dangerous to your life. When your family doctor is not available, when there's no doctor available. And also there's usually a wait time. Depends how busy in the urgent care center. If there are many patients there, you may need to wait longer. And if other patients more serious than you, they see them first. But if you are more serious than the other patients, they will see you first. Okay. There's only one urgent care center in the city of Winnipeg. It's called Misericordia Health Center. Okay. Because hospital emergency is for real emergency, life and death situation. So if you are not serious, for example, maybe you sprain your ankle and you go to see hospital emergency, you may need to wait for many hours. You may need to wait longer hours, sometimes maybe 8 hours, 10 hours, 12 hours, or more if you are not serious. So, and sometimes you may have questions about your health or your questions about your children. You may want to ask a nurse. In this case, you can call this phone line. It's a 24-hour health information line. It's called Health Link. This phone line is open 24 hours, 7 days a week, and a nurse will answer your questions. And it's also available in 110 languages. If you need your languages, if you need someone to speak your language, you can ask for someone that speaks your language. But when you call this number, you need to understand English first, because you need to understand the instructions that they gave you. So they will also ask you to leave your name and phone number, and the nurse will call you back. There's also another service. It's called house calls. That means doctor can come to your home to see the patients. And this service is covered by mental health. It's free. So at the end, the handout also gives you information where you can call. And for doctor to come to your home, usually when you call those numbers, they will ask about your health condition. If it is urgent and serious, they will ask you to go to urgent care or emergency. And another service that you are able to use is called public health nurse. So if you have questions about your health, your children's health, or your health of your family, you want to talk to a public health nurse, you can call them. So in the area that you live, some of you may live in downtown, some of you may live in Singapore, some of you may live in other parts of the city. So each part of the city, you have your local public health nurse. And there's also another health center. It's also in your neighborhood. We call it community clinics. So these are health centers in your neighborhood. For example, if you live in downtown, there's a health center for people living in downtown. If you live in Singapore, there's another health center for people, for the residents in Singapore. We call those community clinics. So in those community clinics, they have doctors there, doctors, nurses, nutritionists, counselors, a team of healthcare professionals that can provide service to you and your family. So you can see, this is a pregnant woman, right? During her pregnancy, it's very important for her to go for checkup regularly to make sure her baby is doing well and she is doing okay. And we call this prenatal care services. It's the service the woman received during her pregnancy. So during pregnancy, a woman has a choice. She has a choice to see a doctor, or she can see a licensed midwife for her prenatal care. And if she decides to see a licensed midwife, so when the time the baby is born, she has a choice to give birth in hospital, at home, or in the birth center. And no matter she wants to see a doctor or a licensed midwife, is covered by mental health. The next area of services, we call it reproductive health services. When we talk about reproductive health, we are referring to the area of health related to our sexual organs, the organs that we make babies. And when we are talking about reproductive health, sometimes we may feel a little bit uncomfortable or talking about it or feel a little bit sensitive or personal. But on the other hand, in Canada, there may be some information is new to you, so it's also important for you to know those information. So in Canada, men and women, they have rights. They have rights to make decisions and make choices about their reproductive health. For men and women, they can make choice about whether or not they want to have children, and if they want children, how many children they want, when to have children. So these are their reproductive choices. And another example is that men and women, they have right to decide if they want to have sex or not to have sexual activity. And here in Canada, for two persons to have sex, they must agree to this sexual activity. And it's against the law if one person forces another to have sex with another person, even though it's a husband or wife or boyfriend or girlfriend. Also in Canada, the legal age of sexual consent is 16 years old. That means legally, a 16 years old can agree to have sex. Even though 16 years old is the legal age of sexual consent, but it's against the law. If a person has sex with someone under 18 years old, if that person is in a position of authority or trust, like a teacher, a coach, or a babysitter. Also, it's against the law if a person gives money, food, shelter, drugs, alcohol, or gifts to someone who's under 18 years old in order to exchange for sex. Okay, the next area of service, we call it birth control family planning. When we talk about birth control, we are talking about methods that people can use for prevention of pregnancy. There are different methods that people can choose if they don't want to get pregnant. And also in Canada, a woman has a choice to decide about her pregnancy. So if she's pregnant, she can decide if she wants to keep the pregnancy or she can decide not to keep her pregnancy. Or she decides to give birth and place the baby for adoption. So these are her choices. And if for some reason she decides not to keep her pregnancy, abortion is legal in Canada. Abortion is legal in Canada if the pregnancy is less than 20 weeks. And also, abortion is a medical procedure. Abortion is, what we mean is that it is a safe procedure and it's legal, but it is also a medical procedure. So where to get more information, if you want to get birth control, you can talk to your doctor. You can go to community clinics. You can talk to a public health nurse. Or you can call our agency, CIRC. We also provide information about birth control. In the handout, there's a phone number for our agency. And CIRC is an acronym, it's a short form that stands for Sexuality Education Resource Center. So healthy choices. We want to keep ourselves healthy. To keep yourself healthy, we need to make some healthy choices. You need to drink and eat healthy food. We need to keep active, exercise regularly. Don't sit too much. Also, don't forget to keep yourself healthy, do yearly medical checkup. Another very important point to keep yourself healthy is that you need to protect yourself and your partner from getting sexually transmitted infections or HIV/AIDS. Here in Canada, there are many diseases you can get from having sex if you don't protect yourself. And HIV and AIDS is a serious health issue here. Every 2 hours, one person is infected with HIV. So it's important for us to know more about it and to protect yourself and other people. So how we can protect yourself? There are some ways. Okay, you can see one way is abstain, that means no sex. So this way may not be realistic for many people. So if this is something that is not a good way for you, so the next way may be to be faithful to each other. When we talk about faithful to each other, we need both partners, two people are committed to each other. We need a commitment of two people, only have sex with each other but no other people. If one person is faithful but your partner is not, or your partner is faithful but you are not, it doesn't work because disease can pass back and forth. The next method is, a good way is to use condom every time when you have any kind of sexual contact. Another way to keep yourself healthy is that get test. Because there are many people with STIs or HIV, they don't have symptoms and they don't know about it, but they can pass disease to other people. So go and get tests. Those tests are free and private. And also in Canada, if people are HIV, there are good medicine that people can take, and after they take the medicine, they can stay healthy for many, many, many years. Also, do not share needles. Sharing needles is also a very dangerous activity. Many diseases can pass from sharing needles. And do not share personal items like toothbrush, razors, or nail clippers. Through sharing those personal items, sometimes diseases like hepatitis. Hepatitis is infection of the liver. Hepatitis B and C. Okay. And we are almost to the end. And just want to introduce you, this is our website. So if you are interested to get more information about different topics about sexuality, you can go to our website. We have also developed many resources, many pamphlets, many information in first languages and in different languages, African languages and other languages. So you can also go to our website if you want to read those resources in your own language. And also, a little bit more information about what we do in our job. We work a lot with immigrant newcomers. We work with newcomer parents, youth, as well as couples. And we have workshops for them, for immigrant parents or newcomer parents, because we know that there are many challenges raising children in this new country. So we have workshops for parents, for youth and couples to get together and talk about those issues and how to build a better relationship with the children. And with couples, how to build better relationship with each other in a new country, because there are many challenges with gender role changes in this new country. So thank you very much.